Pertussis. What is it? Causes and symptoms, best and worst outcome, most and least expensive treatment, recommended evidence-based practice approach, and the best health professionals.
Pertussis, or whooping cough, is a highly infectious condition within the respiratory tract caused by the bacteria Bordetella pertussis. Once contracted, the period of contagion may last for several months. Pertussis is generally caused by respiratory droplets released into the atmosphere or from being within close physical contact with a person who has contracted pertussis. Swelling occurs within the lungs, resulting in prolonged coughing fits. The period in which the symptoms of pertussis manifest generally occurs between 7 to 20 days. These symptoms may include fever, breathing irregularities, vomiting, fatigue, or apnea, especially in infants.
According to reviews found on the Cochrane database, there is insufficient evidence to suggest that antibiotics or other treatment therapies will influence the clinical course of the pertussis infection. Antibiotics have shown to be effective for eradicating B. pertussis from the nasopharynx if administered at early onset, helping to stop the transmission of the highly infectious disease. Therefore, the outcome is generally dependent on other variables, with two of the most important being age and vaccination status. The best outcome for children is a mild presentation of symptoms which improve without the need for intervention. Furthermore, it is beneficial if the disease is not transmitted to vulnerable individuals such as infants and pregnant women. The worst outcomes are more likely to occur in young and unvaccinated infants, but can also affect older children and adults. They include complications such as apnea, cyanosis or lack of oxygen from coughing, pneumonia or brain damage.
The most expensive evidence-based approach for treating pertussis is the use of intensive care or hospitalization. The costs of each age range are slightly different based upon their average length of stay within the hospital or care unit. Adolescents and adults have an average cost of stay of about $5,310, with the length of stay being around 6 days. Children have an estimated average cost of $4,729, with the length of stay being roughly 3.7 days. Lastly, infants have the highest average cost per stay of $9,580, with the average length of stay being 3.4 days. On the other hand, the least expensive evidence-based approach is the use of antibiotics during the early stages of the illness. The average cost of using antibiotics per patient is $242 for adolescents during the whole period of illness, and $225 for adults. In my opinion, the best approach would be vaccination, as it drastically reduces the chance of contracting pertussis. However, if pertussis is already present, taking antibiotics is the best approach if caught in its initial stages. This is because it's less expensive overall and allows the patients to resume a normal routine faster than if they were hospitalized. Pertussis is generally less dangerous for adults and adolescents than it is for infants, so it is highly recommended that the younger generation are vaccinated promptly. Ultimately, due to the small number of quality studies, insufficient evidence exists to recommend treatment for whooping cough. Therefore, it is important that you reduce symptoms and spread to others by keeping your home free from irritants, using vaporizer, washing hands regularly, and encouraging the drinking of fluids.
Best suggested health professionals for treating pertussis are general practitioners and pediatricians. A general practitioner does not specialize in a certain medical field. However, they provide routine health care such as examinations and diagnosis. There are many benefits of visiting a GP as they know the history of their patient. This enables them to make accurate diagnosis, become aware of warning signs, and monitor changes in the patient's health. Pediatricians work on providing the best health care for the children by managing their physical, mental, and emotional well-being. Health service providers also have an important role in promoting vaccines and ensuring patients have access to important information.
Which one of the following is not an above-mentioned symptom of pertussis? A. Fever. B. Headache. C. Vomiting.
Is brain damage a potential bad outcome of pertussis? True or false?
How much does it cost to keep an adult with pertussis in care for 6 days? A. $2,000, B. $5,000, or C. $10,000.